Piazzi of Gray Matters Care Management. So, how many of you are aging? Hey! Yeah, we're all aging, right? Have any of you heard of Aging Life Care Management? I think Gabriella's cheating because she knows me. So, Aging Life Care Management is what I do, but it is a growing industry, not so much in San Antonio, but in other markets. And they used to call us geriatric care managers back in the day. So I've been working with older adults for over 30 years. I started right out of college as a social worker in long-term care, which is another word for nursing homes. And I've been working with older adults ever since. But I've had my own business, Gray Matters, for a while now. So it's between Austin and San Antonio. I've been in business about 13 and a half years. So what is an aging life care professional? Most of us have a background in nursing, social work. I'm a gerontologist, so people go, a gero what? And I studied aging, so I just couldn't get enough of it. I love older adults. I'm very passionate about working with older adults and their families. So I went to UIW, before it was UIW, when it was the college back in the day. So they used to have a master's in social gerontology years ago, which they don't now. I wish they did. So we have to be knowledgeable about aging, healthcare services, resources, all kinds of things. We also follow a very strict code of ethics and standards. And there's fees that are out of pocket, but also, you were talking about insurance earlier. Long-term care insurance also pays for care management, depending on the policy. I also work with the Area Agency on Aging and through ACOG. So if y'all have ever heard of the Alamo Area Council of Governments, they run the Area Agency on Aging, and I'm a contractor for them. So I actually serve people in Bexar County and surrounding counties for free through that agency. So we try to provide peace of mind. When you're working with adult children, which is mostly who calls me, even through Area Agency on Aging, I have families that are very stressed. Many of them are employees. Many of them are like any of us. They're trying to raise a family, or they're working. They're trying to retire themselves one day, hopefully. And they're stressed because they are also trying to help an aging parent. We see a large growth in my industry of the person that is juggling not only being a caregiver, even a long-distance caregiver, but also maybe they're helping their own children. Like myself, my father's in a facility and I have a daughter in college. So we're called the sandwich generation. We're sandwiched in between, and there's many of us out there, more than what we even talk about, publicly. We don't talk about how some of us are kind of getting pulled between the generations, right? And as women, as myself a woman, I feel obligated to be there and to be supportive, but it is a challenge, right? So the things that we do as care managers is we try to provide professional support. We try to develop a plan. So it's not just about going and meeting with families, it's actually creating a plan. So kind of like you and your work as an insurance agent, you got to start somewhere and develop a plan and say, okay, what are our resources? How do we pay for this? What are the benefits out there? How can we get these services without paying? Am I a veteran? Do I have other ways to get monies through federal government, through Medicaid? Does Medicare cover this? And those are the questions I try to answer with families. A lot of people think Medicare covers everything. Just so you know, it don't, right? Yeah, it don't. People think, hey, I'm working, I'm paying into Social Security, Medicare's going to pay for this. It does not. Medicare only covers mostly skilled care. So if I'm in a hospital, it's going to cover most of that. If I'm in a rehab, if I need medical equipment, if I have Part B, but we have to have money. So someone like you that does insurance, or we need to be saving and having a plan, because we're all aging. 10,000 people are turning 65 a day in the United States. And those are the boomers. Those numbers are increasing. Older adults are going to be the largest population by the year 2030, more so than young people. So we got to gear up. It's not a joke. It's getting serious. We know what the costs are today, right? Inflation, and we see what the costs are, whether it's for food and other things and electricity and living. But if I have to pay for a caregiver, or if I have to pay for my house to be fixed because my house is aging just like me. I got to have a plan. So I'm dealing with all these issues with clients. How do I cover this? How do I get support? I monitor clients. So I have clients that I look over as an advocate in facilities. I coordinate care. So I'm handling the day-to-day. So I have clients that I'm actually with till they pass. Sometimes their families don't even live here. So I'm with them. I'm like, they used to call us a surrogate daughter, but that's not really cool because I'm not taking the place of the daughter, but I am serving in a capacity that's important where I'm reporting back to that family member, to that power of attorney. So speaking of that, when we're thinking about our own aging, do y'all have all your documents in order, right? Who's going to speak on your behalf if something happens? Who's your medical power of attorney? Who's your durable, which is your financial? Do you have a directive to physicians stating your wishes? Okay, so if something happens to me and I'm terminal, if I get COVID, like we were talking about earlier with the group earlier, people can have it. My husband's uncle who raised him just died Saturday of COVID. Unexpectedly, he went in the hospital Friday and he died Saturday. My husband's in Kentucky right now trying to help his aunt. We did not plan for this. We didn't plan for a plane ticket last minute, but this stuff is real, right? We all know things happen and we got to have a plan. So think about your legals, think about your wishes, and what do you want to do? So as an aging life care manager, I'm the hub and the wheel. I'm like juggling a lot of stuff, looking at crises, family conflicts. Rarely do I get the family that's holding hands and singing Kumbaya. It's very rare. When I meet them, I'm like, I want to study you. You're a rare breed. Where have you been all my life? But it's very rare. Most of the families I deal with do not get along. They're not communicating. There is a primary caregiver or family member doing the bulk of the work. So we call that the dutiful daughter. There are dutiful sons, but most of the time it is a daughter or daughter-in-law that I'm dealing with. And they're burdened, they're stressed. And sometimes their siblings are not always real helpful. So if you're a sibling out there and your loved one is a caregiver to your parent or aunt or uncle or grandparent, be supportive, be a help, make phone calls for them, give money, whatever. These are kind of typical scenarios. This is a case, this is like our typical work. I'm worried about my mom. Mom's in her 80s, widowed and lives alone. A lot of my work is with those with memory impairment. I'm mostly working with people with dementia, diagnosed or undiagnosed, and I'm trying to get them the help. Because if I have dementia and I'm living alone, it could be pretty bad. It could be scary because if I'm not managing my meds, I'm not getting to a doctor, my food in my fridge is not healthy, it's rotting. I'm not paying my bills. It goes on and on. And those are the cases I walk into. A lot of times I'm coming in with adult protective services or after them, or my client hasn't opened the door to them. So I'm the guy that's got to try to go, hey, let me in. I want to try to help you. So it's a challenge. A lot of times the families don't live here. So this daughter lives far away. She's worried because the neighbor calls. And a lot of times that's how it goes. Somebody's calling and letting that family member know, hey, your mom or your aunt or whoever is not answering the phone, or they're not getting their newspaper, they're not coming to the doctor, they're not coming to church. So the red flags are there. So if the care manager evaluates, so we're doing in-depth assessments. It's not just a quick, hey, how you doing? It's digging deep. It's a holistic assessment looking at everything from medical needs to psychological need. I'm doing testing. I'm doing basic cognitive screenings. I'm doing depression screenings. I'm looking at everything from mental health needs to social needs, financial. What can we get to get some help? And I'm really utilizing the Area Agency on Aging. If there's anything you hear me say today, the Area Agency on Aging is the go-to. It's like the best kept secret in Bexar County, really, for aging services or disabled services. So I'll give you all that number at the end. I'm not going to do that one. So this is kind of our areas of expertise as a care manager. We have to know a lot about a lot of things, but we can't know everything. So we have to have a lot of good friends in different places. So we have to have, geriatric physicians, geriatricians. We have to have elder law attorneys. We have financial planners and different people we go to or refer our clients to. So kind of when to refer: memory loss, mental health issues. People think older adults don't have substance abuse. I've had clients that were alcoholics. They were addicted to opioids. I had a client that was severely addicted, and she wasn't old. She was about my age. I'm 55. She was a little older than me. And she was severely addicted to opioids. She would get them from her hairdresser in a little bottle without a label. And so I had to jump in and get her mental health services, get her placed in an inpatient psychiatric unit, and get her treatment quick because it was dangerous, very dangerous. So these are things that happen in real life. Sometimes people don't like to talk about it. It's uncomfortable, but it is real life. As a care manager, we try to have that balance between safety and autonomy. I'm not coming in telling people how to lead their lives. It's up to them to make choices, and I just try to do the education and guidance. When to refer, this is kind of a busy graph, but it just talks about, the process we go through, especially when there's abuse, neglect, and exploitation. 70% of cases of financial exploitation are family members. Okay, this is over the U.S. So I do presentations on elder abuse, and I do it with a actual person that works in fraud for the city, and he's also a U.S. Marshal. So we used to go out and talk a lot to older adults, and people think, I'm going to trust my daughter or my son, but we have to be careful who we're putting in charge of our monies or who's also the co-signer on our accounts. We got to be careful about who we're trusting, right? So I belong to a large national group, and this is their website. And so aging life care managers are all over the U.S., Canada, and England. And so if somebody had to find a care manager, they could go to this site and search for someone by zip code, county, state. Kind of things that we have to prove ourselves in is when to choose a person. I'm certified as a care manager. I've got a master's degree. So many of us have graduate degrees and a lot of years of work experience, but you got to start somewhere. So we want people to come into this profession because the population is aging.